Hi, welcome to my final presentation. My name is Jessie Murray, and I'm a senior, and this is my second year in ISM. My quote for this year was, "The best way to find yourself is to lose yourself in the service of others." I kind of based my whole year off of that. I wanted to help others. I wanted to work in making people feel better and get them back to their best potential, so that's why I chose that quote. My topic was pediatric nursing, and I really focused on my research in oncology nursing because one day I hope to be an oncology nurse. A little bit about me is I'm known as the mother of the group. I kind of always watch out for everybody in my friend group. I volunteered at Children's as a student volunteer, and I got to serve in the playroom before kids went into surgery to kind of help them stay calm and get their mind off of things. And then I'm kind of shy, and it takes me a little bit to warm up, but once I do, I'm not shy anymore. And then this is my second year. Why I chose pediatrics is because I adore children, and I definitely don't want to work with older people. I want to stay with children. I want to make a difference in their life, knowing that they're young and they still have their whole life to live. It's a rewarding experience, and it reminds you how blessed you are to see kids that are so sick going through such a hard time and their family going through a hard time, but they stay positive, and it's really rewarding to be a part of that process and know how blessed you are that you didn't have to go through that. Something I found about cancer, and I really liked it, is what cancer cannot do. Cancer is so limited. It cannot cripple love, it cannot shatter hope, it cannot dissolve faith, it cannot destroy peace, it cannot kill friendship, it cannot suppress memories, it cannot silence courage, it cannot invade the soul, it cannot steal eternal life, it cannot conquer the spirit. I really like this picture because cancer is so hard, and it's very mental. The whole process of it, if you get really down and think that the worst is going to happen, more likely it's going to, but the more positive you say, it gives them more fight to the whole experience. My mission statement for ISM is my mission in the Independent Study Mentorship Program is to conduct research and gain hands-on experience to acquire a better understanding of all the tasks a pediatric oncology nurse performs daily. With the help of a mentor, I plan to learn how to deal with this emotional career as I work to develop a product related to my field of study. In ISM, I am looking forward to growing not only as a person, but also in my love and knowledge for nursing. So my ISM journey started out with the business symposium at the beginning of the year, and I got to meet with many different professionals of different fields and learn how to interact with them and interviewing skills and kind of get out of my comfort zone and not be so shy. Then the next thing was the UNT field trip. I was late to my first class, and then I could not find it, and we missed the first lab I was supposed to attend. And then I was supposed to attend an anatomy class, and when I showed up, the professor was not there, his assistant was there, and they were taking their final exam because he decided to speed everything up in the course and end early. So I did not get to sit in that class, so I went to a business class, and I learned that I definitely want to stay in the health field. And then I did research over nursing in general, and I focused on oncology just to get a background knowledge of what I want to be. And then I did some interviews with professionals to help find a mentor and learn about their experiences and what they do as a nurse. Then I picked a mentor, Mr. Higginbotham, and I've been so grateful to be able to work with him. Then I did my original work. So my research highlights was, the first one I did was on the daily duties of a pediatric nurse and what I will be doing as a nurse, and the career options that I will have as a nurse and the responsibilities I will have to make sure I am very charting everything and keeping up with everything, because everything has to be documented as a nurse, and that's a very big responsibility, because if you don't document something and something happens, you're liable and you can lose your nursing certificate. So nurses administer IVs and medication. They do their rounds, make sure that their patients are feeling okay, and try to get them as less pain than they are in, and hopefully the goal is no pain at all. And then you guide patients and their families to a healthy lifestyle. You kind of have to guide them and show them what they need to do to be successful and be healthy as possible, but you also have to respect their beliefs, and you can't put your personal opinion in there. You have to be very professional. You provide support to the patients and their families, especially in pediatrics. The patients are scared and what's going to happen and what's going on, but their families are too, especially the parents. Their babies are their pride and joy, and no parent wants to see anything bad happen to their kids, so you have to kind of help support them and lift them up and know that you're there if they need anything. And also, your job is to provide the best care possible for the patients. The goal is to get them out as soon as possible so they can live a normal and healthy lifestyle. So communication with patients was something that I really focused on, and I really took this to heart because I'm kind of shy at first, and I know that I have to get out there and talk to the patients. I have to talk to their parents, see what's going on. That's the way you're going to identify what a patient needs. Especially kids, they can be quiet at first and scared, so you have to make them feel comfortable, make them know that you're there to help them. You're not trying to hurt them, even though if a shot or an IV hurts at first, it's going to make them feel better, and you have to communicate that with them. You always have to be honest with the patients and the family, no matter what the diagnosis is. You can't tell them that everything's going to be fine if you know it's not going to be, but you can still be positive. And then it also builds trust with the patients and their family, because sometimes when the kids are in the hospital all day, the parents have to go to work, and so you want the parents to be able to trust that they're okay and they're in good hands while they're gone. The next article I read was Taking Your Work Home, and it was about an oncology nurse who loves his job and how he gets emotionally invested, but he also has to know when to kind of pull away. And a lot of nurses say, oh, it's not okay to emotionally invest, it's strictly professional. But he said that's kind of like you don't have a heart, like you're just cold and you're there to do work. He's like, you have to get invested in the family, get invested with the kid, but you have to know where your boundaries are. He said, build a personal relationship with them, but always stay professional. You build that personal relationship, but you don't friend them on Facebook. You don't do things outside of the hospital, but you know that you're supporting them and why they're in the hospital, that you're personal, you know what their likes are, you know what they're doing outside, just to make it seem a little more homey in the hospital. One thing I read from this article and took away is I don't want my patients to feel like a number, and especially in a big hospital, you want them to feel like when you're spending time with them, they're your patient. All your attention's on them. All you care about is getting them better. And then he also said you have to take time for yourself when you're working on that emotional career, because it is very draining and you can get emotionally invested, and the outcome of the patient might not be what you wanted or expected. So you have to take your time for yourself, kind of cope with it and mourn their death, and just know that everything's okay and you're doing what you're doing to help people, and so it doesn't beat you down where you don't want to do it anymore. The next article was me time, and it's important to fuel yourself. The article said to spend your first paycheck on yourself. You spent a lot of years going through nursing school, a lot of time on your feet, and it's just good to reward yourself. You're always helping others, and you're always giving and giving, and sometimes you have to take for yourself, or you're going to get drained and you're going to end up not enjoying your job. If you were to take time for yourself, it's more like you look forward to going back to work. It's a lot of long hours, a lot of time on your feet. It's 12-hour shifts, so most of the time you're there, you spend time away from your family, you miss the holidays and events. So it's important to know that you have to do things for yourself, and it helps you refocus. And the next research I did was at nursing school. Since I am a senior and I will be going off to college, it's important to see where my future is going. So the first school I toured was University of Arkansas, and it had a nice facility, advanced technology. It was really cool that it had cameras in every single sim lab. So you could watch how a situation played out and how you handled it, so you can learn next time what to do better, what not to do, and it will just help you grow. They did something different that none of the nursing schools I have looked at have done so far. They do a point system. So instead of it just being based on your GPA and your science grades, they look at all your grades, where you did your prereqs. So if you did it at the University of Arkansas and you got all your prereqs from there, you'll get points. But if I were to say I went to University of Oklahoma, I wouldn't get points for that. And they also look if you take honors classes, which I didn't really like. At first I was like, oh, it's kind of cool. It gives you don't have to have such a high GPA. You don't have to have as high sciences. You have other options to get into nursing school. But then you have to take honors classes and write a thesis, and it just ended up being a lot more, and you wouldn't get as much time to focus on your sciences and study. So that weeded out University of Arkansas for me. And then I went and toured University of Oklahoma. I had already toured the school and I knew that I liked it, but the nursing school is not on campus. It is actually in Oklahoma City. So I went and looked at the nursing school there, and they have 3 small locations. So they have University of Oklahoma at Oklahoma City, they have it at Tulsa, and then they have it in Lawton. And so it gives me more options if I were not to get into Oklahoma City, which would be my first choice. I would still could get into nursing school my first year. And then it's a smaller program, so their programs aren't as big. That's why they split up into 3. So it's more one-on-one. You get to work with a nurse, and it's smaller clinical groups, so you get more attention and more growing. They also have a program that helps pay for your schooling if you work in a rural area or on a reservation. The government will pay back your schooling, and University of Oklahoma was the first nursing school that said that to me, and they really pushed it. They said that even though you want to go to a big city, you want to work in a big hospital that has pediatrics, they said honestly a year or 2 of your life it will pay for all your schooling, you won't have debt, and then you can worry about finding your dream job. And also the University of Oklahoma kind of sold me when they had a pediatric hospital on their medical campus. So when I go to nursing school, I will get to do my clinicals in their children's hospital, and it also has oncology. The next article I read was Showing Up, and it's about being on the oncology floor and how every day you have to show up, be 100%, and take care of those kids. This nurse had a hard time finding an oncology job. She really wanted to work at St. Jude's, and she kept going back, and she never got a job. And so she'd go back and interview for the next time they had a job opportunity, and she never got it. But eventually, after a few years of trying, she got a job at St. Jude's, and now she's an oncology nurse. She said you cannot judge. She had a hard time at that at first as an oncology nurse. These kids were so sick, and she was a mom, so she's like, these parents would be going to work and they would be going and doing things, and she's like, why aren't you here with your kid? Like, how can you do that? But she said you have to really realize that they need to pay for these medical bills. They have other kids that they have to still spend time with. Even though their kid is so sick, they're trusting you to be a second mom to them when they're not there. But you also have to realize that they do have parents that love them and are doing everything to make them better. So you have to keep that boundary where you don't step over and step on anybody's toes. And she said it is your job to be on the same page. You can't just start doing things that what you think are going to help the patient with not getting approval with the parents. The parents need to know what the pros are and what the cons are of it, and you have to be the one that educates them on them, because most of the time the doctors leave it up to you to be the educator. So the next part of my ISM journey was my interviews, and I interviewed 5 professionals that were all great and made picking a mentor very tough. The first interview I did was with Miss Gaffney, and she is a school nurse at Allen Elementary. She was my mentor last year, and I loved working with her, but I wanted to see a little bit more of the hospital setting. She graduated from Frisco High School, so it was kind of cool. She worked in the ICU at the beginning, and she said it was very stressful, and it was very sad job to see people dying and seeing their families so upset from it. So she switched to the wellness side, and she gets to see healthy kids, and even if they are sick with something, a few days later they'll be back at school and they look great. She said that school nursing is perfect for raising a family. She has a daughter and she has another child on the way, and so it's perfect hours. It's not 7 to 7, you're not working nights, so you get to spend time, and you also get the summers off. And then her advice to me was study your butt off. She said nursing school is very hard, but it's very doable. You just have to be very organized and have your priorities straight. She said if you want to do it, you can do it, but you just have to have the dedication. Then my next interview was with Mr. Higginbotham at Children's Medical Center Legacy. He is a pediatric nurse, and he is on the acute care services. He used to be an oncology nurse at Medical City in Dallas, and then he moved to Children's Legacy where they had oncology, but they no longer have the oncology program there. He sees kids healthy and in a better place, so that's why he loves doing what he do. Like, even though they grow up and get healthy, and then the other kids that don't, he knows that they're in a better place and they have fought their fight, and it was time for them to be relieved and in peace. And his advice for me was don't be afraid to ask for more money. He said when he was interviewing for his job that they offered him something and he came up with a higher price, and they said okay. And so he always has done that since then. He knows that other nurses that are doing the same thing as him or have a higher degree as him, he's making about the same amount of money because he asked. He said, don't be afraid. All they can say is no, we can't do that at this time, and you can decide if it's worth it or not. He's also a very honest nurse, and that's why I chose him. He was straight up and said he didn't like the way a program was run, so he would not be a nurse for them. He said that he has to believe in what he's doing. So that is one reason I chose him as my mentor. My next interview was with Christine Ellis, and she is a former pediatric nurse. She hasn't been out of nursing school that long. She went to the University of Arkansas, but she did some pediatrics and she did the NICU, and she realized that she really wanted to teach it and that she wanted to be in the classroom setting. So she's going back to school to get her teaching certificate so she can teach nursing. And her advice to me was that it is okay not to know it all, and someone will always know more than you. She said sometimes you're not going to be the best nurse there, and you're not going to be able to get an IV. You're not going to know what's going on, but you have to ask, because you can't just act like you're knowing it at all and then mess up, because that's that patient's life. So you have to kind of just be like, hey, I need help, and someone's always going to brag and act like they know it all. And she said you have to get along with your coworkers, so just kind of ignore it and know that you're doing the best job that you can do. Then my next interview was with Amy Minton, and Christine actually connected us. They were friends at Medical City when she worked in the NICU. And so Amy is a pediatric oncology nurse, and she has been doing it for a few years, but she decided that she doesn't know if she's going to do it that much longer. She said nurses do it, oncology nursing, right when they get out of school, and some of them stick with it for a few months, some of them stick for it for a few years, and then some of them do it for their whole career. She said it's just really draining, and you just have to get strong, and she said sometimes it takes people a long time to adjust to it. And she said her advice would be to start out doing something not so extreme and start out with just regular pediatric, and then do maybe that pediatric ICU so you can build yourself up and kind of get used to the emotional connection you'll make with your patients. She said it is very emotional, and she gets very emotionally connected and invested in her patients, but she says she has to know her boundaries. It's very hard, and she's known that her whole time, so she has stuck to that about knowing her boundaries the whole time as a nurse. But she let one patient slip through, and she said it was very hard on her, and she said that never Facebook a parent or a patient, never, go to their soccer games, never go to things that they're involved in, because you just get so invested in if the outcome isn't good. It's just makes it a lot harder on you, and it makes it a lot harder to see other patients and give them your full attention. So she said know your boundaries, keep it in the hospital, and keep it professional. She said educate the parents. You have to let them know what's going on. That's the most important part. So you have to be very communicating. You have to be open. You have to let them know, and you be approachable, so they feel comfortable coming to you. You can never have an attitude. You always have to be positive. You always have to be willing to help. And she said in oncology nursing, you have to act fast. She said as a nurse, someone can come in with just a little infection. They're going through chemo, and they can think, oh, let's take time. She said you have to let the parents know as soon as they start running a fever, as soon as they say they're not feeling good, you have to bring them in, because a little infection, a little virus can turn from something small to something really big really fast. So she said you have to act fast. You need to know treatment. You need to educate the parents that they need to act fast, because kids with cancer have a very low immune system, and they have no ability to fight anything off. Then my last interview was with Mrs. Smith, and she works at the Forest Park Medical Center in Frisco, and she is the OR nurse manager. So she manages the OR and all the nurses, and she said that you have to balance between work and play throughout nursing school and throughout just getting all your careers. You have to know when it's time to be at work and stuff, but you have to be able to connect yourself from work. You have to be able to connect yourself from school, and also have fun, because if it's just a job that you're always putting time in, you're never going to do anything, you're never going to want to go to work, you're never going to enjoy it. So she said just take time for yourself, balance between working hard and playing. And then she said you have to stay neutral as a manager. She is the boss for a lot of nurses, so she has to listen to everybody's side of the story and never blame anybody. The most important part is to fix it and to make sure it never happens again. And she said, now sometimes there comes a time where you have to make the decision that someone's not doing their job right and they're not being responsible, and you have to decide what to do with that. But most of the time you stay neutral and hear everybody's side, and you just want to fix it and make sure the OR is running smoothly so that there's no confrontation. And then she took me on a trip around the OR. So I got to scrub in and put scrubs on, put mask on, and then I got to see a hysterectomy, and then I got to see them getting ready for a spinal surgery, and like they showed me the bed, and because they have to lay face down, and it like can cave in, so you have to make sure all the locks are on it so the patient, while they're working on the surgery, doesn't fall through the table. Then I saw them prepping a person for wrist surgery, and when I got in there, the nurses were talking bad about a doctor, and they were very upset because they called him, he got there early and they weren't ready for him, but the surgery wasn't supposed to start later. And then the next patient that they had, that doctor was running late. And so they were just kind of, Miss Smith told me, like, it's okay, you need to vent and get it out sometimes, but you have to be careful when and what you say, because the doctors will not like it if they hear you talking bad about them. Then my next part of my mentorship, my ISIM journey was my mentorship. And my mentor is Mr. Higginbotham, and he is a pediatric nurse at Children's Medical Center. And I chose him because he used to be an oncology nurse, so since I couldn't get in with an oncology nurse, he could still share his experience as an oncology nurse, but still show me like hands-on experience. And he was so willing to help, and he was so honest about everything, and he's been experienced. I have loved getting to work with him. He takes me around on all of his rounds. He lets me sit down when they're charting and get report, and he shows me how to chart and what everything means. He's been so helpful. He's let me take the vital signs of a few patients. He lets me draw up like medicines like Motrin for a baby, and so I get drawn up. Of course, he checks it, makes sure everything's okay, but he lets me do hands-on. He lets me watch him interact with patients, and that's really what I want to see. I want to see how he interacts, how he handles situations, and he lets me see all that. We had a diabetes patient that came in, and they were a new diagnosis, so he was teaching them how to do blood sugar tests and insulin and all that. So he let me practice on their like stem thing they had, so I could practice like taking blood and then putting drops on it to measure how much blood sugar, what their blood sugar levels were and how much insulin they needed. And then he let me prick his finger with one of the finger pricks, and he's talked about letting me do some IVs in his hand so I can practice, since I can't practice on patients. He'll let me practice on him. So then I did my original work, and I made a patient plan created by the patients and medical care team, which is the doctors, the nurses, and the family. There's a lot of people that go in. There's the physician, the physician assistant, the nurse, and the family is a big part of it. And then I did research on leukemia. I chose leukemia because that is a very common cancer in children. And I started from the diagnosis, the tests that were run, the chemotherapy drugs, and the course of treatment that the patient will undergo. And then as a nurse, I will play a major role in a patient's health plan, not only help writing it and knowing what I will need to administer, but also to educate the family, like this is what's going on, this is the next step, this is what is going to go on from here, and in case this happens, this is the plan that we'll have to take from there. So you have to know it, and then you have to be able to explain it. So who was a part of the cancer care team? Of course, the oncologist and the oncology nurse, they work pretty much side by side. The oncologist is a doctor who specializes in the diagnosis and treatment of cancer. They will design a treatment plan and follow up care for the patient. The different types of oncologists who may be involved in your treatment of cancer include the medical oncologist, which they treat the cancer with medications, the surgical oncologist, which treats the cancer with surgery, and radiation oncologist that treats the cancer with radiation. So a lot of these oncology nurses will work together. Some patients might need surgery and just medication. Some might do radiation and medications. Some may just do surgery removal. And so it depends. You can have all three, you can have one, you can have two, and it just kind of depends. Then there's the oncology nurse, and she is specially trained to care for the patient and their families, and then the nurses work with the doctors during the course of the patient's care. And their duties include monitoring the patient's physical and emotional health. It is very draining for them, and you have to watch them to make sure they're staying in high spirits. And then administering the treatment for the patient. Chemo is very, like a lot of chemicals, very strong, can be very harmful, so you have to make sure you're doing it the right way, and everybody that is around is being treated just as well. Then educating the patient and their family on how to prevent complications, reduce side effects, and how to care for the patient at home. And then what other members that can be a part of the health team, your oncologist or nurse may recommend these services. So it could be behavioral medicine specialist, clinical directors, clinical research coordinator, financial counselor. Chemo can get very expensive, and insurance does not cover everything, so you have to make sure. There's medical assistant, patient service technician, nurse practitioner, oncology clinical nurse specialist. There's a dietitian, oncology fellow who's in school to become an oncologist, a pharmacist, oncology social worker. Sometimes they need social work. Pain management. Chemo can be very hard on the body, cause a lot of pains, a lot of symptoms. And then there can be your psychiatrist for the emotional help, psychologist, radiation therapist, and radiologist. Some more of my research was the symptoms of leukemia, what to look for, and sometimes it's the typical fever, chills, fatigue, weakness, loss of appetite. But then there can also be other things that don't show up right as leukemia way, as anemia, which is like the low red blood count. And then I looked at a chart of how to calculate how much chemo is needed based on their weight, their height, like the stage, what their body can handle. There's a lot of things that go into it, so there was a scale there to look on. And then some drug information about leukemia was like your team uses treatments to fight, and you'll find the different types and what they react with. Some of those drugs, they can be used together, some of them can't be, some of them can cause a very bad reaction. So you have to learn about how it's administered and the potential side effects by each leukemia drug. My original work was, here's my patient plan. My patient's name was Elizabeth Smith. The medical oncology provider name was Kyle Johnson, and so it says like the support contact name, what their relationship to the patient is, what the symptoms and the signs are. It starts from the very beginning. They chart the plan for it to the very end of the treatment. It talks about the family history, if they have had cancer before, what type of cancer it is, the diagnosis date, if there's going to be surgery done, if they don't know yet, if it's already been done. Then they talk about the tumor type, the surgical procedure, and then the study of what the blood count was, how high it was for the white blood count and the red blood count, and the staging of whether it's going to be a stage 1, 2, 3, or 4, or if it's not applicable yet. Then there are locations of where it's at, and since it was a blood cancer. Sometimes if it's a cancer in the leg or the back, they'll say where it's found. And then it talks about their height, the before treatment, the weight, the after treatment weight, the name of chemo that they're going to use in the treatment, what day the chemo starts on, and when it is intended to end. It doesn't always start on, it's planned to start on a certain date, but it might not end on that date because sometimes they have setbacks or they get really sick from it, so they have to pause the treatment until they're strong enough to handle it. It talks about the different kinds, if you'll get it, what drugs you'll get on the same day, and then the side effects that they have gotten from it, such as hair loss, nausea, vomiting, low blood count, fatigue, cardiac, and other. The next thing to do in ISIP is my final project, which I started but I have not finished. So I had a hard time kind of coming up with what I was going to do. At first I was thinking about going back and starting on each part that I did from my original work, but it was kind of going backwards and it didn't really make sense. So I decided that I would do research on chemotherapy drugs and alternative cancer treatments, and to see what the pros and cons are in experimental drugs insurance will not support. So kind of in a way that insurance can support the patients that want to try something else than chemo. And then I was going to write an FDA proposal on approving an alternative treatment. It was very hard once I got into this research on picking a side. At first I was all for alternative cancer treatments. I researched a lot on how chemo is very harmful and toxic to the body, and I was like, why would anyone want to do that to themselves? Or if the chemo cures them for 5 years, but then 5 years later they're going to have different type of chemo, they're going to have organ failure. I was like, why would anybody want to do that to themselves when there are treatments in other countries that are alternative and healthy and natural that have shown to be great for them? And I was like, why would anyone want to do that to themselves? But then I started reading on why people choose to do chemo instead of doing a clinical trial or an alternative medicine. And it really was like a struggle for me to decide when I was like, well, what if it was my child that found out they had cancer? I would do anything to have